Good afternoon, guys. How do you define success when it comes to being on testosterone replacement therapy? The online providers would have you believe you can be a better man, you can be the man you're supposed to be, you can gain gym muscles, squat 150 kg, run 26 miles, be the bionic man. It's not really the point. If you're under the NHS, the ultimate goal of therapy is to make you within range. When range is now lower than it was a few years ago, and range does not take age into consideration, so we know that testosterone levels drop with age. So you shouldn't apply the same reference range for somebody that's 20 that you should who's 60. You could also make a very solid argument that whilst it might be normal to have a low normal testosterone level for a 60-year-old, should you accept it? Because aging is associated with low testosterone. What happens when you age? You are preparing to die. From a biological perspective, you are not as healthy when you are 60, when you are 20. When you're supposed to pass on your DNA, when your testosterone levels were at their highest, you were at your healthiest. Your DNA doesn't really want you passing on your genes when you're 60. What's interesting is men do actually retain the capability to pass on their genes. They might have reduced fertility due to reduced LH and FSH signaling down to the testicles, but it's important for a survival of the species. Whilst women, when you're 50, you're obsolete. Us men, just in case there was a mass destruction of younger guys, the old fellas could keep the species going. So there is an argument there. I don't know how true it is, but I think it's quite fun. So the NHS simply wants you within range. I'm sure they're interested in symptoms, but really when it comes down to it, it's numbers. It's a numbers game. And when the numbers do not reflect what is healthy, it becomes quite disappointing. And we hear this story time after time after time. So what do I want? What do I see as a positive marker of success when it comes to your male androgen therapy? Well, qualitative improvement is obviously super important. So reversal of those negative symptoms. It's always wonderful to hear that people are feeling amazing, on top of the world. But there's more to that than simply testosterone levels. There's more to that than balancing testosterone, estrogen, and dihydrotestosterone. It's a mindset, it's a perspective that can only be gained when you think a little bit outside the box. Others would have you believe life is about testosterone. Life is about hormone optimization. There's far more to life than that. So part of my job is to deliver realistic expectations. I can optimize your male androgen levels, but the rest is up to you. I try and guide you, but ultimately it's your journey and you have to engage in the process. But you have to engage in the process and realize that all those things I bang on about 24/7, lifestyle, nutrition, exercise, challenging yourself are all integral to the process. Only when you address the whole picture can you feel amazing. Because if you pin all of your hopes on testosterone, estrogen, and DHT numbers, and you still don't feel amazing, you've missed the point. So, realistic expectations. I obviously want you to feel great, but you need to appreciate there's more to happiness, is that the word, than simply optimizing your male androgen levels. So feeling great is good, feeling great is important, feeling great is wonderful, obviously. But how can we quantify something that is qualitative? It's difficult, isn't it? Questionnaires, surveys, blah, blah, blah. If you have a read of our testimonials, you will read some inspiring stories. You will read some long, troubling journeys that now they are seeing the positive effects of not only just optimized male androgen levels, but also an appreciation of the moment. So I always talk about appreciate the moment, because this moment could be bad, this moment could be ambivalent, but you shouldn't let that deter you from wanting to take that next step forwards. So enough about qualitative symptoms, feeling wonderful, blah, blah, blah. Quantitative symptoms or signs. Well, in this last week, I have had news that we have now 20 successful pregnancies using HCG alongside testosterone. 20. Testosterone monotherapy causes azoospermia by suppression of the HPG axis. So you no longer send LH and FSH down to the testicles. HCG mimics LH, so it's used in the NHS to treat male infertility, but it's not used by the NHS in men who are on testosterone replacement therapy who want to retain fertility. NHS endocrinologists will take you off of testosterone to put you onto HCG. Give me strength. Why not actually treat the symptom or sign that you are causing, that you know you are causing? So HCG with testosterone. 20. It's pretty impressive. And I couldn't be happier for all of my guys that have managed to conceive on testosterone and HCG. 2 of my guys have got 2 children. Incredible. What else? Spoke to one of my guys today, and he informed me that he is no longer taking antidepressants. How cool is that? So you go to the doctors with your low mood, anxiety, depersonalization. Your doctor's got 10 minutes. It's difficult. It is a difficult job, I promise you. I've done it before, so I understand how trying it can be. You're exhausted at the end of the day. 40 patients, coughs and colds, people with cancer, Mrs. Jones with a list of 10 problems, your old heart sink patients, your mental health issues, your psychosocial issues. It's an exhausting job. It really is. A lot of doctors have burnout, and I understand why. Because you want to deliver a good service, but you've got 10 minutes. 10 minutes to deliver this gold standard service. It's nigh on impossible. So when it comes to looking for causation, we should all look to establish causation, but God, 10 minutes. So you're a healthy looking on the external, healthy man. Oh, I think I've got low testosterone. Oh, give me strength. I've got Mrs. Jones next, and she's going to bend my ear. I've got little Johnny who's It's, it's never judge a book by its cover, but wow, When you've got 10 minutes and you're one of 40 patients, a healthy looking young man, it's not right, but it's reality. So you've got low mood, here, have some antidepressants. Now, if you want to be a bit scientific about it, now what's the cause of depression? Now, it's multifactorial, but there are causes, but you have to go really, really deep to find them. Now, the NHS will happily dish out antidepressants. So the most commonest antidepressant that's used is a SSRI, a selective serotonin reuptake inhibitor. And that essentially floods your brain with serotonin. Now, did they measure your serotonin pre-treatment? No, because it's unreliable anyway. But do we know what quantitative numbers or levels we want when we're trying to treat somebody with an SSRI? And the answer to that, no. So it's not very scientific, is it? So we're assuming that you have low serotonin levels because you're depressed. Wow. Okay. It's a stretch, isn't it? It's a big stretch. Now, we know there's an association with low testosterone and depression and anxiety and depersonalization. I also believe there's a correlation between high estrogen and anxiety, because I see it in my guys when their estrogen spikes. One of my guys, okay, just between me and you, because it's, I said when guys get high estrogen, they become whiny little bitches. And one of my guys said to me, "You were right. I'm a whiny little bitch," and so it's quite an accurate term. It's not the most polite PC term, but it hits the spot. So yeah, I'm sure there's a correlation between anxiety and high estrogen in the general population, and because it's quite insidious, it appears very normal, but I'm sure it's not normal. So I think when you have a diagnostic workup in somebody who presents with low mood, anxiety, depersonalization, the NHS tends to do a thyroid panel, they tend to do a full blood count, but they should be adding in testosterone and estrogen levels. And I'll take that one step forward. That should be a free testosterone level, because total testosterone just gives you a very small part of the picture. The bioavailable part is what's important, and that's free testosterone. So yeah, quantitative markers or measures. Pregnancy, that's a big one. Coming off of antidepressant, that's a pretty big one. Because a lot of guys feel very blunted on SSRIs. You're supposed to react appropriately to highs, and you're supposed to react appropriately to lows. Nobody wants to have lows, but you should have the capability to analyse, reflect, and learn from lows to hopefully prevent them from happening again, or at least be able to accept them. Because you will have tough times. It's undoubtedly life is full of thrills and spills. So to think that life should be roses and cheese, that's just not reality. And if you believe that, then you're going to set yourself up for a fall. But you should have the capability to be able to take that low and turn it hopefully into a positive. What else? Well, there's the obvious things like blood pressure, HDL, LDL, hematocrit. But it's interesting. How are we going to affect a change to the NHS? How are we going to demand change? Well, the NHS is a big old dinosaur, isn't it? Are we really going to be able to demand change? I think ultimately you have to accept responsibility. Responsibility for your own health. Now, if we look at, I pay my national insurance. I deserve treatment under the NHS. And you can make a solid argument for you do deserve treatment. You have a medical condition, and the NHS. Well, why was the NHS designed? It was designed on need, not entitlement. Now, if you think about the amount of money that you pay in via your national insurance, the NHS, and let's just think about the bigger picture for a minute, because I think we get a little bit lost in ourselves. We're encouraged to think about ourselves rather than others, and I think that's disappointing. But if you think somebody that needs a heart transplant, how much does that cost? If you think about some poor child who has cerebral palsy, who needs 24/7 care, you think about some cancer treatments, how much does that cost? So when you consider how much you pay in to the health service via national insurance, and you say, I deserve it, I'm entitled to it, you have to think a little bit of a think about humanity, and think about the fact that need in your eyes, just think about need of the community. Now, the NHS really does try and do its best, but unfortunately it's under-financed, under-resourced, and it's abused by pretty much everybody. Now, I'm not saying you abuse it, but I'm saying it's pretty much abused by everybody. So I think what I'm really trying to say to you is you have to take control. And in taking control, it'll be incredibly beneficial to your long-term physical and psychological well-being. When you come and see me, you have to give up a little bit of responsibility. But I don't just take that responsibility and say, I'll do everything, because I can't. We're over 500 guys. And the guys that do best understand that they're in control of their journey, but they've just handed over a little bit of responsibility to me. So when we think about testosterone replacement therapy and what you are trying to achieve, we always talk about normality. But ultimately, the journey is yours to take, and I want you to appreciate every moment. Good times, bad times, but appreciate the moment.